Silvester, Deputy CEO of GP Partners. Thanks for joining us on eHealth Space.
Thank you for having me.
Now, the first question is, GP Partners has a unique model up in Brisbane. Can you explain for us how that works?
In relation to sharing records, one of the things that we have had over a decade of experience, and that is around doing coordinated care for chronic and complex patients in our community. So that model of care is really about trying to keep people out of hospital, trying to keep them in the community, and trying to reduce any length of stay. As we went through that transition, and particularly around that journey in coordinated care, we realised that if you're going to try and you end up with virtual care teams, and this is a very common concept in health, to have virtual care teams. So a patient with a chronic condition goes to see a specialist. They might have a dietitian. They go to hospital quite a lot. They see their GP lots. So they end up with a care team one way or another. If you're going to try and coordinate that care and keep those people out of hospital, what we found was you need information and shared summary information to actually be delivered to and shared between that care team. So that's been our journey, I guess, over more than a decade, and certainly in the last 5 years, then we've realised that we've had to actually put a technology information sharing model in to actually assist that sharing process.
Okay, so as a non-profit organisation, you see yourselves as almost like the network glue that holds this community together and shares information.
I think the analogy to glue is actually a really good one, because we don't actually deliver direct services. So I think our role has been, and we're funded principally by government to improve quality of care, which means that we get very much into that glue process, the transition elements between say a GP and a hospital and an aged care facility. In mental health, how do we get the psychology services and the GP? So most of our, and even Indigenous in Closing the Gaps programs, most of our programs are actually aimed at the gap component, so the glue analogy is a very good one, I think.